And why are you here today?
Visit the eye doctor. And 1 year, they give me appointment for last year for 2 years. I'm come today, I'm to the doctor.
So when is your next appointment?
You just come back sometime
In the coming week? Where you traveling from?
then I'm told.
Oh, but you taxed. And what exactly is wrong with her eye?
Well, she have some new posts like pus, even coming out of her eye. So I wipe it, come back, and tell her wipe it, come back.
And when was the last time she saw the doctor?
Well, sometime last year. Sometime last year.
The junior doctors is the main workforce of the operations here. So if they are absent, it's going to seriously impact our operations. Today, when we did a count, we're having less than 20% of our junior staff coming out to work. So we had to sit down with our senior doctors and we made a contingent plan. In fact, most of the services will have to be run by our consultants. Now, as you are aware, we don't have a lot of consultants to run, the operations for a very long time. So what we have done is we have scaled down operation. We have scaled down our clinic service today. We have scaled down our elective surgery, and our consultants are positioned in the accident and emergency area and in the emergency area to deal with any emergency that will require surgery. So that is the position that we are at this point in time. We are hoping that whatever the issue is, it will be resolved by this evening so that we can go back to normal operation tonight or by the latest tomorrow morning, because it would be impossible for the consultants to hold that position for more than 24 hours. I was told from checking around that the type 5 clinic had their full staff capacity, so they should be working at their full capacity.
So I guess some of the persons who maybe come from here will have to end up go to the
Yes,
type
we
5
would
clinic.
have to redirect them there as well, and I was also informed that the capacity at the Noel Home Hospital is at full capacity, so we could redirect some patients there. And also at the Falmouth Hospital, they had their full quota of their staff. So in the West here, it probably affects Cornwall Regional Hospital the most. I spoke with the SMO from Savlamar Hospital, and he advised me that they were at 50% capacity of junior doctors, and so they were moving to an emergency mode operation as well. And that is what the situation would have been here now in the western part of the island.
If the matter is not resolved within 24 hours as you would like, what is the Western Regional Health Authority prepared to do to deal with the shortage?
Well, the only thing we can do is ask our consultant. We'd have to roster them in a different way so that some of us can be rested in order to ensure that the emergency aspect of the hospital is maintained.
How will patients who have been affected by today's industrial action be dealt with, especially in terms of appointment rescheduling and treatment?
As we speak, those who had to be rescheduled from the clinic were given different appointment dates, and the operation that were postponed, they would have been rescheduled.
I'm from Ames Medical School, which is in Black River. So right now I'm doing my elective rotations here in Cornwall Regional Hospital. Usually on today we should have clinic, which is at the Seventh-day Adventist Church Conference Hall. But due to the junior doctor strike, they stopped taking patients. So as there are no doctors, so it usually the day goes up to 4 o'clock by seeing the patients. So we get exposure to different cases. But today we didn't have any chance, and we don't know how this is going to affect, and not sure tomorrow how it goes. So we'll be waiting. There was a patient who went to the A&E because she had seizures, but when she was in A&E, like the emergency department, there are no doctors to treat her. So it affects the people's life. So I think the authorities, they should think about this. in future I was planning to work here in Jamaica, but I have second thoughts now because of this. The doctors who are losing their jobs, so it affects my career too. So becoming a doctor, it's not an easy task. We are spending like nights, studying nights, sleepless nights, and at the end what we're getting is not really satisfactory. So it affects us, and people come here with the hopes. So when the hopes are not done, they need to do other things. It's like a big career for us, right? So it affects us a lot.
So you're planning to go back home then?
Yeah, maybe planning to go back home, or maybe I may do some exams for US. I may plan to go to US. But I had planned to do internship here to work for a few years. Maybe if I like here, I may be going to become a senior doctor. But I don't know how it goes, as this we should wait and see.